Hi, my name is Dr. Supreet Bajwa and I'm an orthopedic hip and knee specialist based out of Wockhardt Hospital in Meena Road and Mumbai Central. I did my basic training in orthopedics in Mumbai and thereafter did my fellowships and practice in Australia for 3 years. In my hip clinic, the most common complaints of patients showing up is pain in the groin, pain in the buttock, or pain in the thigh radiating to the leg, invariably meaning that there is an underlying hip pathology such as hip arthritis, AVN of the femoral head, or a hip fracture. The general management of such conditions is a total hip replacement surgery. There are many ways to do a total hip replacement surgery, but conventionally in India, it is done using a posterior approach to hip replacement, whereby in you as a patient, there are 4 muscles which are cut before we implant an artificial hip joint. The consequence of such a technique is the initial morbidity that you face as a patient. For example, you cannot sit on a low stool, you cannot turn side to side in your bed, or you cannot ride in a car with a low seating. This is an uncomfortable situation for many of my patients, and thereby I do my total hip replacement surgery slightly differently. I use the direct anterior approach to all my patients undergoing a total hip replacement. I'm one of the only select few surgeons in India currently doing this surgery. This technique uses only a small, minimally invasive skin incision from the front of your thigh, and no other muscles are cut in the surgical procedure. We use special tools and special instruments to retract the muscles and thereby perform the hip replacement surgery. As a consequence, you do not have as much post-operative pain, there are no restrictions for your hip joint, and you're able to resume your day-to-day activities within days. I keep my patients admitted for a day and discharge them the next day after surgery with adequate pain control. If you have any questions regarding your hip complaints, please reach out to us and let's have a chat in our OPDs.